Hey guys, what's up? Welcome to another Lab podcast. Today we have two very special guests from a company called BetterU, and they specialize in psychedelic therapy, mental health, and I feel like that is a very important thing to go over. It's kind of the foundation of health, and you can't have health without mental health. So we just wanted to invite them on today to kind of talk about what BetterU is all about, along with some other mental health topics. So also, of course, we have Kel joining us as usual. And so, yeah, if you guys want to just go ahead, introduce yourselves, whoever wants to go first, kind of, how you got into psychedelic therapy or, mental health in general, and then we can kind of just go from there.
Sam should kick it off since he's been in the psychiatric mental health field for longer.
I'm Dr. Sam Zand. Thank you for having me on. It's really exciting to have these conversations about mental health. My field of psychiatry, I got into years ago. Initially, I did my training at Johns Hopkins, where we did a little bit of research in psilocybin, and I did my med school and residency in Nevada, where I now teach psychedelic medicine along with neurostimulation at UNLV. And I have a big practice where we focus more on kind of holistic mental health. I think as a psychiatrist, I often say I'm a little anti-psychiatry. I think we overdiagnose, we overprescribe, and sometimes we lose the focus of what really matters, the core concepts that are contributing to how we're feeling. And so we built a lot of programs around that. And when psychedelics emerged as a legal option to treat mental health, I collaborated and met up with Derek, who really helped us to expand what we were doing in the office and make it scalable and bring it to the nation. And now we're currently in about 12 states and growing rapidly, really trying to bring psychedelic medicine to an audience that I think really needs it right now. We're going through a lot societally, and these last few years have been rough. And so having a new modality, a new way to treat our mental and emotional health is really what I'm excited about. And so thank you so much for having us.
Thanks for coming on.
Love that. I'm Derek Duchesne. Sam and I connected a couple of years ago, and I was coming out of this really transformational period in my life. I had traveled the world prior for work in the alternative healthcare space. And throughout that journey, I became very burnt out and had a couple of things. If the pandemic taught us anything, it's that everything can change in an instant. Right, whole worlds can be turned upside down, and that happened for me kind of pre-pandemic, right before the pandemic, and everything I identified with as a person with like who I really was. Was really external as opposed to internal. It was my happiness was coming from my fulfillment from work or from my relationship, my partner. And when both of those took a 180, even though I was doing well off with my career, I was mentally rock bottom in the worst place I've ever been. And things just kept getting, worse and worse mentally, and keep kind of digging yourself deeper into these holes of like hopelessness and despair and anger and resentment and all the things. And a friend dragged me into a ketamine clinic. My whole ethos was plant-based medicine prior, and was very reluctant to trying it. I knew people that had used it before recreationally. I knew of ketamine. I just didn't understand, the healing powers of it. And somebody dragged me into a clinic, and thankfully they did, because it probably saved my life. And just that one session. And during that session, there was no treatment prep, like to help me kind of mentally prepare for that journey I was about to embark on. There was no afterwards. There was nobody there to help me unpack it and digest it, and help me kind of really take this newfound connection or kind of aha moments that I had and apply those into my everyday life. So while the medicine was powerful, I saw that that this needed to be done better and in a more thoughtful way. And there was a lot of people probably out there in my situation, you know, in a similar situation, that were having suicidal thoughts, that this could help. And throughout that journey, cross paths with Sam, and he's been a leader in psychiatric care and psychedelic medicine for quite some time before we connected. And when we first connected, we were on the phone for hours and hours just talking about, you know, all the ways that we can help people. And I was really anti-psychiatry, you know, anti-psychiatrist, you know, before connecting with Sam and hearing about the good work that he was doing holistically and really helping people get off of medications, or helping people address their lifestyle habits, and not so much my experience, you know, and that side as a patient was, take this pill, you'll get better, right? And that's unfortunately not how the world works. So yeah, now we're a couple of years in, helping a lot of people, learning every day and growing.
That's awesome. I mean, I know you've definitely helped me because I have participated in your program, and it's definitely made quite a difference. So I appreciate your work more than you know, which is, you know, a big reason why I want to have you on the podcast, because I feel like other people need to know about this. So if, you know, if they've been doing therapy or tried all the medications and they still just can't seem to break through, you know, that wall, this could be a viable option. As far as the science goes, I would love if you could like kind of walk us through how it works. You know, specifically, you guys do, you know, ketamine therapy right now, but also, you know, there's other psychedelic options I know that are going to present themselves as the opportunity to use as well in the future. But I know the legalities of that is kind of the thing that puts that in the background. But if you could talk a little bit about, you know, how it works with the brain, and like why, that would be awesome.
Yeah, I can definitely speak on the science and the clinical application, and Derek can share kind of a lot about how it lands for the patients and for how it can really help people. Ketamine is interesting. It's been around for a long time, 50, 60 years. It was originally an operative anesthetic, which means we used it for like surgeries, and it kind of at very high doses would disconnect the mind and the body in a way where you can actually do surgery and someone's still conscious and breathing and not alert to what's happening and not feeling the pain. During this, they found that actually in the Vietnam War, it was 55 to 75, when they were using ketamine in the battlefields, all of a sudden people were having less of a stress response, less PTSD as a result. And they're putting two and two together and realizing that there was a correlation. So this kind of hit the psychiatric community, and everyone started to try to use this tool to see what is it about this medicine, especially in a lower dosage range, that allows us to deal with stressors in a healthier way. And so what we stumbled upon is the key of neuroplasticity. And all that really means is the brain's ability to be flexible and regenerate and create new pathways and new neural connections. We used to think, you know, don't kill a brain cell, they don't grow back. And that's not true. That's false science. We've learned that's not true. And we're learning so much more about the brain. It's a very young field, psychiatry. So things that we've done just in the last decades, we're kind of unlearning and finding new, healthier ways to treat our mental and emotional health. And so just 4 years ago, 2019, a form of ketamine called S-ketamine became FDA approved for treatment-resistant depression. And it was just a once or twice a week dosage that when you're doing the low dose of that medicine, it helped to reset the brain a little bit. It helped us to be a little bit more flexible and get rid of what we understand is one of the biggest culprits of mental and emotional struggles is rigidity, is this inability to see things differently, is desire to get, to identify with something that's familiar with us, to become kind of a creature of habit in a way. But in many pathways, it's disempowering, and it just get programming from childhood, traumas, stressors that just live in the background, and it's reinforced in our subconscious. And these are the kind of subtle things we're learning about mental health. You can take an antidepressant and boost your serotonin and see if just that little chemical change makes a difference. We're realizing it doesn't for many people. But if we can improve brain function, if we can improve the ability of the brain to see things more objectively, to be an observer rather than a passive passenger, it really kind of enhances this meditative quality in people. And so doing that session once or twice a week, we've seen tremendous results. We've seen improvement in depression. This is used off-label for things like PTSD and anxiety, and the results and studies are just coming out in dozens. There's hundreds of positive correlations, and now they're testing ketamine with alcohol use disorder. They're testing ketamine with not only PTSD, but different forms of anxiety, OCD. While none of these are on label yet, we got to still do some more work. This has become widely accepted because it's pretty safe. The side effects, you might have a little nausea, and so we try to prevent that. We really want people to go in relaxed with some deep breathing and feeling calm going into it, and that kind of helps decrease the GI response that might happen in maybe 10% of people. Blood pressure can go up a little bit, so this isn't for everybody. If you have blood pressure issues, if you have cardiovascular risks that are unaddressed, we always want to make sure and check in on our physical health first. And take some coaching, takes a little guidance. So that's the therapeutic work, the coaching, the integration that we've provided through our modalities, and many other practitioners are learning little by little. So that's kind of the overview, the history. And Derek, perhaps you can talk a little bit about like how it's been for our patients and really the most rewarding side of this.
Yeah, absolutely, and thank you, Sam, for that. It's something where like you said, when typically the way that people have been treating, or the mental health care system's been treating people with anxiety and depression, has been trying to balance out different things of the brain as opposed to that overall brain function. And nobody is thinking, like, nobody's in their right mind, right? That thinks that the only way to living a better life or a happier life is by ending it, right? Like the brain is sick, right? And our brain isn't functioning properly. Our thoughts, aren't, we're in these negative, dark holes, right? And all the time, once a week, at least somebody comes through the program and says, this is something that this is the best day of my life, or this has been the best week of my life. And I didn't think that was possible after X, Y, and Z, right? After going through this much pain in life, or this much loss, or this much grief, and seeing that, right? And being able to be a part of that. But then, like, the medicine does, incredible things, right? But if you're not taking like that window, like Sam said, when we have this heightened neuroplasticity, and you're not kind of taking advantage of that and reprogramming your thoughts, and things that a lot of times people that are going through traditional talk therapy or CBT exercises, or everything's as simple as a gratitude journal, positive affirmations. Like, oh, this would never work for me, or I've tried this, or I've been in therapy for years, and these things didn't work, right? But when you go back and you revisit a lot of these different types of exercises and self-love practices, or you go back and revisit something as simple as spending 10 minutes a day on positive affirmations, or gratitude practice and reflection, it's now our brains are kind of reset and they're more malleable, right? So it makes us a lot more receptive to these things, and it makes it so much easier to change our habits, right? So whether it's breaking old habits or enforcing newer, healthier habits, because while the medicine is incredible, it's really us focusing on how do we cement long-term healthier habits and cementing long-term lasting changes, right? Because we're dynamic individuals. Like, we shouldn't be on, most medications shouldn't be a daily medicine, right? Ketamine isn't meant to be a daily or long-term thing. It's to help us kind of reconnect with ourselves and kind of refill our cup and get realigned. All the time, patients will say, I came into this wanting to focus on, my anxiety, right, or my anger, or process my divorce, and they'll come back and say, I quit drinking alcohol. I stopped smoking cigarettes. I'm nicer to my kids, or I'm nicer to my parents. And like, I just started to realize these things that I do in my life, or this unnecessary pressure or stress that I'm putting on my loved ones, and just getting that clarity and that shift in perspective. Like, a lot of people do things that they think makes them happy, right? Because they've kind of been that programming or that social circle or that network or group of friends that they've been hanging out with. Some people, a lot of people will say, hey, like, I've realized that there's some people in my life I need to spend more time with, or there's some people in my life I need to, probably start to spend less time with, and really just getting realigned with things that are truer to yourself, right? Like, people say, or ask all the time too, is ketamine a psychedelic, right? And the definition of psychedelic is the windows to the soul, right? And I think that that's, looking at it from that perspective, and not so much what the clinical definition of it is it. I think that ketamine therapy, in conjunction with it, could be a beautiful window to the soul, and give you that kind of clarity that can be very challenging to find externally.
Yeah, that's awesome. I mean, I know for me personally, I feel like I was kind of just a cynical bastard, and I was just like, all these gratitude lists and shit. Like, I've tried it and I still like hate everything. So, okay, not really, but kind of. But after ketamine, you're just like so much more open to gratitude in general, or it just shows you like all the things in your life that you have to be thankful for. And previously, it's like your brain just gets stuck in this one lane road, and you can't seem to like get off it. There's no exit. So it's like ketamine just provides you that exit or that detour to actually enjoy the other parts of your life that are there the whole time. It's just like you don't see it because your brain is so rigid. So that like whole neuroplasticity thing, I feel like it just opened my brain to be more accepting of, honestly, just like being softer with myself, and like, actually exploring more sensitive sides and being vulnerable and stuff. And so it's just like, that's been, I feel like, where it's helped me tremendously. So yeah.
Sounds like a massage for the brain or chiropractor. Just pop you all open.
Yeah.
So I know Cody's got a chance to try it, but I'm in Ohio where we don't have anything fun that's legal. And I was telling a couple friends that we were having you all on today for the podcast, and they're like, wow. And the biggest question was, what is the trip like? Like, what is the experience like if you've never had that kind of thing? And I'm not embarrassed to say I've had like psilocybin, but I don't know really the differences between all the types of psychedelics, because they kind of feel like in public media get mushed all together. And I was just wondering if you guys could expound on maybe what the differences are, or if they're just completely unrelated, and kind of describe a little bit more about like what the actual experience is like. Is it scary?
Yeah, I think just kind of speaking from a clinical perspective, and this is a medication that I candidly talk about. It's helped me too. It's helped me through anxious spells. It's helped me to realign. And so I can speak from both perspectives. We intentionally start everybody very slowly on a low dose so that it's more gentle. That first experience, if they haven't had any kind of a mind-altering state or a mind-expanding state, it doesn't really feel trippy or psychedelic. It feels more like a really nice, deep meditation. It feels like we've been able to just kind of clear our mind and think about what's important to us. If you've ever experienced meditation, which takes some practice, it's not easy for everybody. It really is a habitual practice to conquer. This is kind of like the cheat code to get there, a low dose of ketamine. And then you start to learn and realize like, wow, I can achieve this state without the medicine too. So in this way, it's more of a kind of medication-enhanced meditation. Now, when we get to the higher dosage range and we work people up based on their comfort level, then it becomes a little bit more what we would call psychedelic, a little bit more mind expansive. There's almost this overview effect where you kind of see your life from this outer perspective, not so stuck in the emotional charge and the subjective shame, blame, and judgment that we hold, the self-criticism. These patterns tend to dissipate a little bit during this experience. And that's what opens for a lot of people these kind of aha moments, such as, I love my partner. Why am I bringing tension and stress to the relationship and always arguing and never bending, right? It's like, it's so logical to just say, because of that love, that's what I want to start with. But we get stuck and we have so much baggage, and we have these, every relationship has arguments and problems. And sometimes those lead the way when really, we really just want the love to lead the way. This helps us realign that and see it from that outer perspective that tends to just make so much sense. Now, if we're not really prepared, it can be a little bit of a strange experience. If we're going into our subconscious and some things come up, this is why the preparation that we provide is so important. And we really advocate for that, a little bit of me time, journaling, setting intentions, doing some breath work, doing some relaxation prior to going into the experience. And that's what we provide as well through our services, is someone you can check in with virtually to guide you there. The other question you asked was about kind of differences amongst the psychedelics. And right now, if you want to go to a doctor and have this work done, ketamine really is the only option. You can go in Oregon pretty soon to get psilocybin. They're building the infrastructure. It's almost there. Colorado's following suit. A lot of that will happen. Of course, there's recreational experiences that people can have. There's, shamanistic ayahuasca journeys and all of that. But all of these psychedelics share in common is that neuroplastic effect, that ability for our brain, not only during the experience, but afterwards, to continue feeling flexible. They all have their differences very profoundly, and we like to call ketamine kind of like the gentle introduction to psychedelic medicine.
I love that. Very cool. So when we're talking about like kind of how it can help us break these old patterns and like old tracks in your brain, I think a lot of people immediately go to like that trauma side, right? But like I think you've mentioned, like it can help you with just basic anxiety spells and stuff like that. And so there's a lot. It seems like there's a lot of different places that this can really come up and help out people. Can we talk maybe about like kind of the direction you see this going, and how it is moving to help people out of more than just PTSD and depression? Like it doesn't have to wait until it's like the real dark stuff to really kind of work its magic.
Yeah, it's a really good point. I mean, many people have suffered through compound chronic traumas since childhood, right? There's things that we carry with us. It's not the trauma that happens to us, it's how we respond to it and who shows up for us and the support that we have externally, the coping skills we've learned internally. But beyond just kind of these mental health kind of syndromes that we see, depression, anxiety, what we're seeing in studies and kind of experiments that are now being published is anything that causes us to have rigid pathways has an opportunity to now just be lubricated a little bit. And then what we do with that goes the rest of the way. So I'm not a big fan of traditional diagnostics. I think it's a little bit limiting and it's a little rigid and it labels people in a way. But if we can learn from clusters of like personality disorders, narcissistic, borderline, antisocials, those who have no remorse is how we classify them. Those that we often see ending up in jails. We're doing work in these communities. We've helped people come out of jail through ketamine therapy and find a transition back to normalcy, get out of the traumas they went through in jail, but also, prioritize love again, prioritize the healing that they need, focus on opportunity and growth. We've seen a lot of people in end-of-life care where, it's struggling with our mortality, or maybe we lost somebody and we're grieving and we haven't really found a healthy way to grieve. This allows us sometimes an outlet. And if those things go unaddressed, well, yeah, they might turn into chronic depression or chronic anxiety or PTSD. But one thing we're learning from this medication is we can get to these things early before they build the pathways and habits that become reinforced. Unfortunately, we all do it, right? Our negative self-talk, our ruminations, our worry, these things become strengthened. Unfortunately, it's human nature. We all do it. If we can intervene earlier, then it doesn't even set. That pathway doesn't really even have a chance. But if we've had them for a long time, then sometimes it just takes a little bit more nourishment, a little bit more work.
That really reminds me of like, and mind you, I'm a bit of a beefhead, so this reminds me a little bit kind of like if you are learning how to like squat, for example, and like you learn incorrectly, right? You don't get those cues, and it makes such a hard thing to break. But this would essentially help you in your head, not to skip those bad habits formation. So that's very cool.
Yeah, and if you take that even further, let's say you have developed those habits and you're a little bit, asymmetric, and now your strength is a little lopsided and you're compensating. Well, what do you need to do? You got to kind of get restructured, right? You go see maybe a chiropractor or a physical therapist. You do some stretches every day to undo some of the damage that you've done. It's very similar with our mental health, right? We do therapy, we do some journaling. We remind ourselves every day that the stories we tell ourselves aren't true, that they're sometimes derived from trauma or derived from fear. And so we start to instill those healthier habits. And so both preventatively and long after the fact, there's opportunity here.
Very cool. That's so cool. And do we want to pause for Derek?
I was just thinking. I think Derek's he's here. So we can still hear him. It hasn't given me a little warning that says like recording's messed up. So until we see that, we'll just keep it as it is. I know it's still recording his video, even though it's like not showing it to us because it's trying to like calm his connection down.
Okay, cool. So, just wanted to check. Sorry.
Yeah, no, I've been here. I've been here. I was doing this intentionally so we could come back next week and do it again.
We got to just keep it up,
With BetterU.
Fridays with BetterU, yeah.
Awesome. So let's just jump right back in then, huh?
Yeah. So as far as like, what was I going to say? Do you guys? Oh yeah, go for it.
I want to touch on before the internet cut out is what Sam was talking about. The difference between ketamine and other psychedelics, right? They're all very different molecules, right? And we're comparing psychedelics, like it's not like cannabis where it's just one plant, right? And different strains. Like psychedelics, it's thousands of different molecules and in very different experiences and the medical, like the pharmacological aspects of them is, they're vastly different. And we're seeing over the last couple of years, these accelerated, breakthrough labels that the FDA is giving a lot of these things for everything from Alzheimer's, a derivative of LSD for Alzheimer's and dementia, the MDMA for PTSD. Really excited for hopefully one day in the near future, ibogaine for opiate addiction, and because we see that is out of control in the United States, and there is something that has shown tremendous success. So when we're looking at these different types of things, and also the differences, right, is psilocybin is typically a 5-6 plus hour experience or journey on a macro dose, a therapeutic dose. The microdosing, which has become incredibly popular, is a sub-perceptual dose to help increase enhance mood or cognition. Or if you look at LSD, that could say an 8-hour journey and a very different experience, with that too. MDMA is typically, a lot of these other psychedelics are very external things, and realizing the beauty of the world around you. Ketamine is really closing off, when we do our ketamine therapy sessions, it's our psychedelic therapy. When we go deep inside and really seeing the beauty that we hold inside and all of the love that we need in the world. And like you said earlier, Cody, the positive affirmations and positive self-talk and, all that woo-woo science, that I used to never think was a thing either. I grew up in a little farm town in Wisconsin, and you talk about positive self-talk and yoga and self-love, none of that exists. And with this type of therapy and treatment, and it's a very gentle, and like you said, Cal, it's like that massage for the brain. So we kind of turn off the external factors and we go inward, and we do a deep dive kind of exploration, and we can really uncover things about ourselves that we really love, or things about ourselves that, you know, we've been burying down there. And instead of holding on to traumatic events or grief or things from the past that maybe are defining a lot of the things that we're doing today, and, you know, subconsciously, it allows us to look at things as exactly that, just things in the past that happened, you know, and without that normal emotional charge, or without that normal emotional attachment to it. And that, you know, just in that aspect of it alone is incredibly powerful, because it allows us to, instead of just masking symptoms, it allows us to really process things in our past, and you know, then move on, right? So it's there's a tremendous benefits to that. And I think that as far as what does ketamine therapy feel like, right? And Sam said, you know, at the low doses, that kind of medication enhanced meditation can be really, really powerful. And a lot of people, you know, like to stay at that place and not go deeper. Other times it can be as, you know, feeling like you're floating, right? Or you're kind of floating down a river, or soaring, almost like you're flying, like you're soaring over the mountains. And you know, we've heard people say, you know, all kinds of beautiful things. I myself on these journeys and these healing experiences have seen places that I've never, like, traveled to places that I've never been to, you know, seen, connected with incredible people that I've never met, and really, you know, allows us to have different types. Like, no two sessions are ever going to be the same, and they can range from that light, mild kind of quieting the external chatter, all the way to this really deep and pathogenic experience, or out of body experience, and kind of depending on where you're at in that level of commitment of how deep you want to go with the therapy. You know, there's pros and cons to both sides, and it's when done properly at the right dosage and the right frequency, it can be something that I think is going to change the world.
That's awesome. I hope I'm not hammering you guys with questions, but I have another one. So when we're talking about how the brain is able to stay neuroplastic, I don't know if that's the right way to say it, after the drugs have worn off, when we're thinking about like a long-term treatment plan, is this something that you suggest, like, coming back to regularly? Is it something that you do a bunch of sessions closer together? How would you typically suggest that things happen?
Good question. When we do the FDA-approved Spravato as ketamine, their indication is twice a week for the first month, once a week for the second month, and then once every 1 or 2 weeks after that, forever. That's what they you know, we don't agree with the forever part. I mean, you can make your own assumptions as to why they might think that's important. But, you know, for us, we tell our clients, let's give this at least 1 month, maybe 2, maybe 3. But if we go 3 months, let's take a month off. Mm-hmm. Let's see if that compound kind of regular care that you've given yourself and working with the team, if you've noticed lasting benefit, great. We don't want you to be on this forever. And so what we've seen functionally is if people are going through something very recently, then maybe just 1 month is enough to kind of work themselves back to who they used to be. If it's something that they've been struggling with, that the programming has lived in their subconscious for years, decades, then maybe a few months gives them more time to do the work in between sessions, once or twice a week. And then for some people, we really do realize that, you know, let's take time off to let the body refresh and make sure that we're not having any tolerance or dependence or anything. It's only once or twice a week. But we might want to continue and check back in every few months, or do this, you know, at 2 months on, 1 month off, long term. So the protocols are all kind of varying. There is no really one way to do this. We just have the FDA approval from Spravato. But that's more or less how we explain it to people.
So it really is like the squat and like figuring it out.
Yeah, I mean, the brain functions in many ways just like a muscle, right? It's, you need to flex it and strengthen it. And so it is a great analogy that makes sense. Yeah.
Cool.
And a lot of people, you know, they will come through our program, right? And they'll do, say, a series of like 4 to 8 sessions. and they'll say, wow, I really have found like what I've been looking for, or I feel like I'm in a much better place now. And after that, like kind of second month, like, but now, I want to take time off to gauge kind of the lasting effects of it. And then, maybe, or as needed. So a couple weeks in, like I'm starting to feel some of these thought patterns creep back in, or starting to kind of feel like I'm falling back into a rut. So I want to go back into it. Right. And then other people, like, nothing's worked. I've tried every type of medication therapy, for a very long time, and this is really working for me. And so I want to stay on this, right? And even then, after about 3 months, we tell them, hey, let's take some time off to gauge, where we're at in the lasting results. And most times, when we can get people, like so many people get attached to that. I need this to feel better, right? This, like if a doctor says take this pill every day, right? I need this, like, and it become these creatures of habit, or even that placebo effect that, like, even though I didn't take my melatonin, like I'm not going to sleep unless I take something, right? So it's the kind of a similar thing where if somebody is once you can get them past that mental hump, that hey, let's I know that this has been working, we're not pulling you away from the program or the system, but let's take some time off. And almost every single time they're like, wow, this is really beautiful and really incredible. I haven't been able to not take a pill for the last 15, 20 years. And then from there being able to gauge properly, is it once a month, once every 2 weeks? Is it they take a few months off and then come back on and do another series of 4, right? So everybody's mental health journey is very different, right? And it's also our neurochemistry, and where the kind of journey that our own brain has been through, right? Because a 250-pound 23-year-old athlete could be it could take significantly less, like a fraction of what it would take a 60-year-old 100-pound female, that most medications kind of based off of weight and age, right? And then this is like, but she's been on, he's healthy and hasn't been on any medications, right? Or healthier, his brain, and she's been on 15 years of benzos or SSRIs, and that's caused a lot of things, for the brain, a lot of disconnect. So everybody's different and everybody's journey is different, but we try to make it as infrequent as possible. But I think in office, like for IVs and IMs and for our program, like you want to start getting going like that once, twice a week to achieve that kind of reset and get back to a baseline, or feeling better, or feeling more comfortable in your own skin. And then from there, revisiting with the clinician and assessing what that treatment plan looks like.
Very cool.
What would you say is the biggest difference between, like, the IV form of ketamine versus the, like the lozenge kind? Does it feel different? Is there like a different approach, or yeah?
So many factors to consider. I think the first one that most people have to deal with is the cost and the logistics. And so, unfortunately, IV is kind of expensive. We offer it in many of our offices. I am as well. Just having the materials, the staff, and all of that, right? Traditionally, in the past, it's been $1,500. We brought it down to about between $500 and $700, based on the package, and there's other options. You have to leave your home, and some people, that's stressful. You're driving around. You can't drive home. You're dealing with traffic. You're dealing with the clinic. Maybe you're just anxious, or maybe you're agoraphobic and it's just hard to get out of your house. So those are some of the disadvantages. But one of the benefits of IVAM and IV is it really kind of blasts you into a high dose. So some people who need that, who need to kind of, maybe they're on a lot of other medication, or maybe there's just other reasons why medicine isn't sitting well, isn't hitting them at a low dose. You get access to kind of bump that up quickly. Now, with the lozenge, you get the flexibility to do it at home in your place of healing. Many people set up their own cocoon that just feels warm, and they don't have to worry about other stressors. We can achieve the same potency, really, with the oral absorption, and we just have to kick up the dose more. So it also gives us a little bit of time to kind of flex that dose and gradually introduce them. Or if you go to an office, it's almost like you see a doctor and you have a cough and they didn't give you an antibiotic and you're like, why did I come here, right? They don't want to undershoot. They want to give you something. So sometimes they overshoot. And that's where in the office we see a lot of trauma from the experience. Maybe there wasn't a therapist or a coach or a guide helping them get into it. There wasn't any relaxation. So those are the factors I would consider if I was thinking about different methods of administration. They all have pros and cons.
Good to know. Yeah.
Very interesting. Let's see, how do I want to phrase this? Where do you guys know very much about where like the legislation's going to make this more available to more people? And if you don't know that, that's fine. I'm just curious.
And working in this business, we've become like medical legal experts.
Yeah.
We can definitely answer that. Yes, 10 different lawyers will get 10 different answers. The general consensus of things is ketamine is available in every state. It's legal. It's a Schedule 3 controlled substance, which is similar to like Ambien and such. And so if you go to your doctor, though, and say, can I get this? They're just probably going to look at you sideways and say, I haven't learned about this because it's new. And while I'm teaching it to our psychiatry residency here at UNLV, most psychiatry programs don't have this in their curriculum yet. So you have to find a niche specialist, someone who's just knows what they're doing here. And then if you do find that, the question of seeing them in person or at home right now for another 2-3 months until May, telemedicine is still allowed in most states. So you can find a program like ours and see your provider online, and the package, the brain box, gets shipped to your home with the blood pressure monitor, a meditation mask, a journal, all these goodies to help you along your way, along with the medication. Starting in May, you'll probably have to go in to see your doctor for the first time in person, and then if you want to continue virtually from home, you have that luxury. States are going to change in that, and this is all as it pertains to ketamine. Psilocybin is, it has a divergent path where we'll just see, is it going to be like marijuana where it's recreational and medicinal? Is it going to be more guarded by the medical industry and get some FDA approvals? Probably a little bit of everything. But down the pipeline, Derek alluded to MDMA isn't far away from FDA approval for PTSD and many others. So we also have a wellness center where you can come out to our locations like Puerto Rico, for example, in the jungle and do this work with the doctors. So it is all ketamine based. There's certain kind of ayahuasca retreats and things like that where it's not always legal. It's still done.
Yeah, we don't know anything about any of those types of retreats, and we do not condone any of those types of retreats.
Right.
I feel like ayahuasca is terrifying. Like I just like people's experiences are just like, wow, yeah, that's a lot. I'm sure it's great, but
I think there's a lot of ethical issues with that as well. Like a little what's the word I'm looking for? It takes over from the natives and indigenous people who actually used it for things. But
we've seen amazing people. People come out and be very vocal about their ayahuasca experiences and say it's helped them a lot, which is really great, right? And then also it's a very dangerous substance too. Something that you won't hear much about, or people that talk about ayahuasca a lot, is that it can be lethal, right? And it's rare, but since most of these things are happening, in foreign environments where the medical care may or may not be there, a lot of these substances, including like ibogaine, can be lethal, right? They can really these are very powerful compounds, and while a lot of them do help us really look inside and have these kind of shifts in perspective or shifts in our kind of internal belief systems, it's doing them properly and doing it in the right circumstances. There's no reason to, if you're going to go on use any of these modalities for your healing experience, right? It's like there are places to go where there is medical supervision. There is beautiful, souls and healers and shamans that combines the two of them, right? So just I'm a big advocate for safety first, and a lot of people can turn to psychedelic therapy as a last resort or out of desperation because nothing else has worked. So just make sure that when you are looking, if you want to travel to the jungle and go on a spiritual journey, then please do that if that's what you're called to do. But understand that to do it properly, it's going to take a lot of preparation, thousands and thousands of dollars, and do a lot of research. There's some really incredible places out there. If that's not within your bandwidth, and you feel like that you really want help and you want to help now, that this is available locally. It is available, through telemedicine as of right now. Like Sam said before, the telemedicine laws are changing in the very near future. But BetterU and our doctors and our clinicians will be available in all 50 states, within a couple hours, or within your metropolitan cities. So there is legal guidance, and there is clinical, and our team isn't just a bunch of doctors saying, here's the science behind this, right? Our team is just a lot of really incredible people that have been through it, and this type of medicine is really, really helped them and transformed them. And that's why we've created this collective of people on their own healing journeys that makes it a lot easier when people are calling in, or a lot easier when people are going through tough times, to be able to connect, hold space, and allow them to feel, kind of a lot of times deeper emotions, whether it's, higher highs or lower lows than they felt in a while, and really feel that connection again with themselves and the outside world. So, that's what we're here. We're here to help, and everybody, it's your choice of your path. Of some people think that traditional medicines, are effective for them, and for those that it is, that's fantastic. For those that it's not, we're here, and for people that have tried everything and are really struggling, and especially people with suicidal ideation or suicidal thoughts, like, please, call us or call a local clinician that is experienced with psychedelic medicine or psychedelic therapy, because this can save lives.
Yeah, for sure.
Oh.
That's awesome. So, we've gone over, psychedelic therapy and how helpful it can be. Is there, folks out there who might not be good candidates for psychedelic therapy? I know there's, I've seen a little bit of who may not be, the best to try it. So I was just wondering if you kind of had an overview of that as well.
Yeah, I can run that list briefly. It's if you're really in a state of extreme mania or psychosis, and this is something that probably needs more medical attention, you're not a good candidate. If you have uncontrolled seizures, uncontrolled blood pressure issues, uncontrolled cardiovascular risk, if you feel like, you're not in your healthiest state, you just had a heart attack, you just had a stroke, like those things need to be addressed first. Really, other than that, if you have severe liver damage, because it is processed through the liver, if you're pregnant, breastfeeding, or planning, we don't recommend this. And that's kind of the list for strict contraindications. Our clinicians and most who are in this space will work with you to understand your medical background and make sure you're a good candidate. Our program, if you're not a good candidate, we refund you fully. Right? We want to be there for you. We don't want to cause any financial stress. So it's pretty easy to kind of learn that and work through some of those things.
Nice. Awesome. Go for it.
So we've talked a little bit about the science. We've talked about who it can help, who it can't help. Can you kind of walk us through the logistics of how, if like I wanted to get help from BetterU tomorrow, or that's an exaggeration, but like as soon as possible, can you just talk to us a little bit about like the logistics about what a patient would go through?
So you go to @Dr. Sam Zand on Instagram, send him a message.
Dr. Sam, help me.
Yeah, no, you said tomorrow. I mean, you can get care today, right?
Yeah. It's 4:00. It looks like we can take the next 15 minutes and do your psychiatric evaluation. No, so and this is something where, when we're struggling with our mental health, it's not, I have insurance, right? And I live in California. If I want to get in through my insurance to see a psychiatrist or to see a therapist, it's going to be, 60 days, 60 to 90 days. And a lot of times when we're struggling with we don't have 60 to 90 days to then get into a doctor to try something to maybe see in the next 4 to 8 weeks to see if it's maybe taking effect, right? So we're very thoughtful and very conscious of that, and then try to be as available and meet people where they are. We can get people in, typically within 24 to 48 hours, depending on the state that they're in, for their, at least at the bare minimum, a free consultation, to get in with a clinician. It's typically about 48 to 72 hours. And what you do is you go to our site, it's www.betterucare.com, but the letter U. And then you can either take an assessment, and that's just a few questions to go through a couple of contraindications. And then after that, you select your package. And we have two different types of package: the introduction and the transformation. The introduction is typically for people that have more recent mental health struggles. The transformation is for people that have been dealing with something for 12 months or longer. And after you select your package, then you'll be prompted to fill out your intake documents and schedule your appointment with a clinician. A licensed psychiatric clinician will then join your appointment or your virtual call, and they'll go through. Sam, you want to go through the what happens on a psychiatric call?
It's a nice evaluation where it's not like you're going to see a psychiatrist because there's something wrong with you, right? We're just trying to find what's right with you. We're trying to get a medical background to make sure that this is safe for you. Learn what are some of the things that have been contributing to some of those emotional conflicts. Start to set the foundation for that self-exploration, not only to modify and rewire some of those disempowering pathways, but also to increase self-love and start to realize that whatever happened, whatever our programming is, and for whatever reason, that's okay. And we can keep moving forward if we just love ourselves and find ways to align with what we're feeling and transfer that energy in a positive way. This is the initial work done with the clinician, just to prepare that education and that framework. It's about a 30-minute session. And then if you are deemed a candidate, we'll go over the education, the safety, and further the therapeutic guidelines. You get your package in the mail, and then you check back in with your integration guide, who will help hold space, give you some framework. And then you start your treatment at home with your peer support, someone in your life, a family member, a roommate, someone who can just keep eyes on you and monitor, make sure you're okay if you need support.
Yeah. So after you have the clinical appointment, then you're prompted to schedule, before the medication arrives, to schedule your appointment with our integration coaches. The integration coaches will walk you through. So you'll have access at this point, access into the member portal. And the member portal has another review of all the safety precautions, lifestyle protocols of ways to kind of detox our mind and body before going into the experience, a history, of the medicine, and then we have structured sessions. So journal prompts pre and post session, different playlists, and we focus on four different stages of healing, and it's heal, grow, love, transcend. Let Sam jump into those in a second. But then, so the integration coach will walk you through all of those and make sure that you've understood everything there is on the treatment preparation side. Watch a treatment preparation video, answer any questions. If you're nervous going into your first session, they'll do a little breath work or a little meditation with you and help you kind of calm the nerves and help you be more open to the experience. And then after that, so you'll receive the medicine in the mail. And then you put the medicine, you administer it into your cheeks. You have to hold it in your mouth for about 12 to 15 minutes. And then you put on headphones, sleep mask, lay down for roughly around an hour, about 45 to 90 minutes. And it's a really gentle and beautiful and can be very transformational experience. Afterwards, we have a lot of prompts and that we spend this time to reflect and journal and really kind of write down or voice memo any of these new kind of thought patterns or epiphanies or aha moments or anything insightful that came in. And then we focus like on our integration, and that can be writing, that can be drawing, that can be a whole number of things, different exercises in the portal. And then after you've done that low dose, so we start at a very low dose and kind of titrate up to find the right dose for you. After about the third session, you jump back on with the integration coach, and they help you kind of not only unpack and process the experiences, but then looking at the other things in your life, right? Your nutrition, your habits, and your goals, and start discussing those with you, and really looking at that holistic approach and how can we take what we've learned during these sessions and apply it into our everyday life. And that's basically the gist of the customer experience. And Sam, can you talk a bit more about the protocols and the program?
Yeah, there's a lot of therapeutic exploration. I think that's just the key point is, doesn't matter how you do it, self-growth is all about just learning more about yourself and learning how you interact with the world around you. And our relationship with the world begins with our relationship with ourselves. So, we just start with healing. What's getting in the way? What are the emotional obstacles? What are the thought patterns? What are the physical toxins? And let's just start to release that emotional stress and give ourselves permission to feel better. And then we get into growth, and that's just self-improvement, coaching, cognitive behavioral therapy. And then it's self-love. And self-love is interesting, especially around holidays like Valentine's Day. We often feel lonely. We often feel that our relationship is not what we want to be in. We feel that we can't find the right person. We feel that we're not worthy of the right person. And all of those relationship patterns start with how we feel about ourselves. And so this work in psychedelics is really just about that acceptance, that self-love, and that self-exploration. And then finally, when we conquered and we feel good about ourselves and the momentum's going in the right direction, then we realize that we're just not that important. And the final step is self-transcendence, to focus on something bigger than self. And realize that there is a communal bond in society that if we can't align with, it feels good. And it's not about us. It's about giving. It's about connecting, understanding this life, mortality, and these spiritual applications, these unanswerable questions about life. Why are we here? What's the purpose? This is what we guide people through, and really it's empowering them to take that journey themselves.
I love that.
Awesome. Yeah.
So awesome. Really wish I could go through the program. I need to move to California.
Yes. Yes, you do.
It's a month or two.
Well, I think that's a lot of my questions. I know we've had you guys for about an hour now. Did you have anything else you wanted to ask, Cody?
I think just one thing to touch on, because a lot of our audience, is in the LGBT community, just to verify. So, are you guys LGBT friendly? If someone is trans or something along those lines, are they going to find it difficult? Or, are you guys pretty educated on the topic, or just like open to everything basically? Because obviously I have not had any issues. But just to kind of pick your perspective a little bit on things.
Well, and it's something that I know last time that this is a couple times back, where we attempted to do this, but something we didn't touch on yet today was our coaching programs, right? And the different types of communities that we've are really dedicated and connected to. And part of that, and Cody, thank you for all of the amazing work, and Kel, thank you for the amazing work and the uplifting, inspiring content that that you guys put out there, right? And wanted to dive into with last time, have you guys found it challenging, in your communities, and Kel, in your community, to find mental health care or clinicians or therapists that can connect with you or understand you?
Yeah. It's rough sometimes.
It's rough. And I know I'm in the Midwest. Cody's in the most conservative part of California, which, I mean, let's be honest, it's still California. But anyways, I do know I've had a lot of issues. I did most of my transition in Texas, South Texas, so that was extremely challenging. But yeah, I think it can be really hard, and I think even more so, it can be really freaking scary, just because the medical community is so hit and miss. It's either really awesome or really, really terrible. And it's risky as a person going in alone into an office, or even contacting someone with that fear of rejection and that fear of what you might be put through, to put it frankly. So I think I know a lot of my clients, and I know probably a lot of Cody's clients have a story, if it's working with doctors at some point, that they were scarred by. Yes.
I think it's always a question with when you're filling out intake forms, there's like, do I tell them, or do I just kind of pretend it's not a thing, So it's always in the back of your mind. So it's more like, if we could put it out there that people don't have to be afraid. They can be forthcoming about, if they're trans, gay, whatever, that you guys aren't going to change the treatment plan because of it, or, like try to transform in a very weird way. So like, yeah, I guess that's just like the main thing to hit home. Like, are people who come to you, can they come to you just as themselves most comfortably, and, be comfortable with telling you if they're trans or etc. and things like that?
Yeah, I mean, absolutely. I think the basis of the work we're doing is to help us find our truer self. And that exploration is a lifelong journey. So I think the work is innately aligned with that exploration, with understanding that we are not our bodies, we're not our mind. We're a composition of things that we don't fully get. It's, as a psychiatrist, I consider it more of an art than a science, the work that we do, because for anybody to have a rigid belief about who we are, why we are, it just assumes that we really have understood, the essence of life, of the mind, of psyche, of the soul. And these are things that are just, they're unanswerable. And so the exploration is what we're after. And cultural competency is something that's so important to us, because we need to meet you where you are and make sure that you feel comfortable in an experience like this. And it's the exact opposite of most doctors who you go to, and they do their things their way, and you've got to kind of fit into their box and their protocols. We create that box, we create that protocol individually for everybody. There is no box, rather, right? We customize things. So that's why I think not only just in the LGBT community, in any community, and if we feel lost, if we just don't even understand life or who we are, like, this is a path towards finding your truer self. And I think we really want to aid in that exploration.
I love that.
That's awesome. Yeah. I was just thinking about like my first time, first or second or whatever, after the initial dose, being afraid, because you're like, okay, this is very transformative. Like, am I going to discover something? Like, am I not trans? Like, so there's like this weird, like, okay, let's see how this goes. But it's funny because it kind of just like hammered it down, because it was me basically meeting people in my past, like my grandparents, I didn't get to come out to, or they didn't get to meet me as Cody. So basically that's what that whole first session was. I was just going around like meeting people as myself, as me, and just being like, hey, it's me, it's Cody. And like, they were so, accepting. And it was like, I got to relive a moment that I didn't get to live. And so I was like, oh, okay, good. We're good.
And thank you for sharing that, Cody. And that is that really incredible, like, powerful work, especially in those first couple sessions. Very frequently, people will come to us when they've recently lost somebody, and a lot of times we'll say, I was able to have conversations or have or connect or share things, with this person, and having that, closure, or having that connection that that wasn't there previously, coming out of that even though it's an internal experience, can be incredibly transformational, incredibly powerful.
Yeah, awesome. Well, I guess, we've had you on here for quite a long time. So you guys okay with wrapping it up for this episode? I mean, of course, you're always welcome to come on again.
Right?
Do you all have any last words or anything that we didn't get a chance to cover that you wanted to mention before we sign
I
off?
just want to emphasize the point that, this is a treatment that for many people, there's apprehensions. Do I need this? Is there something wrong with me? Does signing up for mental health support mean that I'm admitting my flaws? That's just not true, right? We're trying to help people realize that none of us are sick. None of us are ill. If we're a little bit feeling not our best, a little sad, a little anxious, a little confused about things, there's just a path towards exploring and finding out what area of your life needs more attention and more balance. And that's really what this work is there for. Obviously, you need to qualify, and there's disqualifications for different medical reasons. And so we go through those appropriate steps. But if you're someone who's just feeling like, you're doing all right, but you could do better, this might be for you. If you're somebody who's suicidal and you just really realize there's other options haven't been there for you, please reach out. Please take a moment, because this is something that can transform our future, and we see it every day. It's so fulfilling. So just a call to action that if it's not us, then any clinician, if it's a therapist, just a counselor, start the conversation and, be there for yourself, love yourself, especially in this time, Valentine's Day. Self-care is everything. So that's just my 2 cents for the holidays.
Thank you. How about you, Derek?
What Sam said.
Ditto.
Yes.
It's if you're looking at and when the time from, I'm not sure when this airs on your side, but it's Valentine's Day. Like many holidays, but specifically Valentine's Day can be very, very challenging for a lot of people, and feeling like like we're potentially missing something, right? Or reminiscing on past partners, right? And I think that being able to reflect and look at all the things that we can do, even if you're with a partner, all the things that we can do to fill our own cups, and really focusing on that self-love and that self-care and pampering, because you can't show up in the world and you can't really give love to others until we've really filled up our own cups. So kind of reframing what Valentine's Day is about, and it's not just love for another person, right? It's really that love for ourselves, and that self-love allows us to bring more love and light into the world.
Yeah. And maybe, ketamine therapy is a great Valentine's gift to yourself. If you need something. All right.
Well, thank you all so much. Really, really appreciate your time. I know you all are very, very busy. So thank you again. And we're definitely going to have you on again for some more talk.
We'll see you next week, Calicote.
See you next week.
Appreciate you.
All right. Thank you so much.
Thank you.